Human metapneumovirus, or HMPV, is a virus that infects the lungs and airways. It spreads easily from person to person. HMPV often causes mild symptoms like a cold, but it can be serious for some people. This includes young children, older adults, and people with weak immune systems. In late December 2024, news broke out about an HMPV outbreak in China. The virus was spreading very quickly. Hospitals in China saw a concerning rise in patients with breathing problems. Many of these patients, especially young children and older adults, needed to be hospitalized. This outbreak caused immediate worry. Health officials were afraid that HMPV could spread beyond China. The world watched nervously as China dealt with this new virus threat. Everyone prepared for another possible pandemic. This situation reminded everyone that global health is interconnected. An outbreak in one part of the world can quickly become a global problem. The HMPV outbreak showed how important it is to detect outbreaks early, respond quickly, and cooperate internationally. Facing a rapidly growing HMPV outbreak, China took immediate action. The government put in place several measures to control the virus's spread. These measures included increased tracking and monitoring of respiratory illnesses. Hospitals and clinics throughout China were put on high alert. They improved their screening procedures. Testing for HMPV was increased. Public health campaigns were launched to educate people about the virus. China's response to the HMPV outbreak received both praise and criticism from the international community. Some praised the country's quick and decisive actions. They recognized the importance of early intervention in containing a potential pandemic. However, others criticized the lack of transparency in the early stages of the outbreak. They argued that more open communication could have helped with a faster global response. Despite the challenges, China's experience with the HMPV outbreak provided valuable lessons for the rest of the world. It emphasized the need for strong public health infrastructure, effective communication strategies, and a proactive approach to disease surveillance and control. The World Health Organization, or WHO, was closely watching the HMPV outbreak in China. Recognizing the potential for international spread, the WHO issued a global health alert. The alert urged countries to strengthen their surveillance systems and prepare for potential cases. The fear of a repeat of the 2019 COVID-19 pandemic was on everyone's mind. The world had witnessed firsthand the devastating consequences of a rapidly spreading virus. Governments and health organizations around the globe scrambled to assess their preparedness for another pandemic. Travel restrictions were imposed and screening measures were implemented at airports and border crossings. The global community held its breath, hoping to contain the virus and prevent a global health crisis. The HMPV outbreak served as a stark reminder of the interconnected nature of our world and the shared responsibility to protect global health security. The HMPV outbreak posed a significant threat to African nations. Many countries in Africa have fragile healthcare systems. They often lack adequate resources, infrastructure, and trained personnel. This made them particularly vulnerable to outbreaks of infectious diseases. The COVID-19 pandemic had exposed the weaknesses in Africa's healthcare systems. It had overwhelmed hospitals and strained resources. The HMPV outbreak threatened to worsen these existing challenges. The WHO and other international organizations recognized the urgency of the situation. They pledged their support to African countries in strengthening their preparedness and response to the HMPV outbreak. However, significant challenges remained in ensuring that these resources reached those most in need. Section 5. A global call to action combating HMPV on all fronts. The HMPV outbreak in China triggered a global call to action. International cooperation was crucial in containing the spread of the virus and lessening its impact. The WHO urged countries to share information, resources, and expertise. Global health organizations, governments, and research institutions came together to coordinate their efforts. They focused on several key areas: strengthening surveillance systems, enhancing laboratory capacity, developing diagnostic tools, and raising public awareness. The global response to the HMPV outbreak highlighted the importance of a coordinated and collaborative approach to global health security. It underscored the need for investment in public health infrastructure, research and development, and international partnerships to effectively address emerging infectious diseases. Section 6. Echoes of COVID-19, HMPV's potential global impact. The HMPV outbreak raised concerns about its potential global impact. While the virus was still in its early stages, experts warned of the possibility of widespread transmission and significant economic and social disruption. The COVID-19 pandemic had shown how quickly a virus could spread globally, causing chaos in economies, healthcare systems, and societies. The HMPV outbreak served as a stark reminder of the interconnectedness of our world and the vulnerability of global systems to infectious diseases. Economists predicted that a widespread HMPV outbreak could lead to supply chain disruptions, reduced productivity, and a decline in global trade. The travel and tourism industry, which had already been severely impacted by the COVID-19 pandemic, faced further uncertainty. The social impacts of the HMPV outbreak were also a major concern. The potential for widespread illness and death could lead to fear, anxiety, and social unrest. Lockdowns and other public health measures, while necessary to control the spread of the virus, could have significant social and psychological consequences. Section 7. The Race Against Time, HMPV Research and Vaccine Development. As the HMPV outbreak spread, scientists and researchers around the world raced against time to develop treatments and vaccines. While there was no specific treatment or vaccine for HMPV yet, previous research on similar viruses provided a starting point for developing new therapies. Pharmaceutical companies, universities, and government laboratories collaborated on research efforts. Clinical trials for potential antiviral drugs and vaccine candidates were initiated. However, the development and approval of new medical countermeasures was a complex and time-consuming process. The HMPV outbreak highlighted the importance of ongoing investment in research and development for emerging infectious diseases. It also underscored the need for international collaboration and data sharing to accelerate the development of life-saving treatments and vaccines. Section 8. Strengthening Africa's Defenses, a multifaceted approach. Strengthening Africa's defenses against the HMPV outbreak and future health threats required a multifaceted approach. This included addressing the underlying factors that made the continent particularly vulnerable to infectious diseases. One crucial step was to invest in healthcare infrastructure. This included building new hospitals and clinics, equipping existing facilities with necessary medical supplies and equipment, and training healthcare workers. Improving disease surveillance and response systems was also essential. This involves strengthening laboratory capacity, training epidemiologists, and establishing early warning systems to detect and respond to outbreaks quickly. Public health education campaigns played a vital role in raising awareness about HMPV, promoting preventive measures, and combating misinformation. These campaigns needed to be tailored to local contexts and delivered through trusted channels. Section 9. Lessons Learned, Future Secured International Collaboration in the Face of HMPV. The HMPV outbreak in China served as a stark reminder of the ever-present threat of emerging infectious diseases. It highlighted the need for global solidarity, international cooperation, and a proactive approach to global health security. The lessons learned from the COVID-19 pandemic, including the importance of early detection, rapid response, and equitable access to medical countermeasures, were directly applicable to the HMPV outbreak. By working together, sharing information, and coordinating their efforts, countries could effectively combat the HMPV outbreak and future health threats. The global community needed to prioritize investments in public health, research and development, and international partnerships to create a safer and healthier world for all.